Here is a PDF document published by the British Medical Association, which seems to be the #1 source of information for all NHS doctors. I'd like to draw your attention to a few paragraphs. Unnecessarily invasive procedures should not be used where alternative, less invasive techniques are equally efficient and available. It is important that doctors keep up to date and ensure that any decisions to undertake an invasive procedure is based on the best available evidence. Therefore, to circumcise for therapeutic reasons, where medical research has shown other techniques to be at least as effective and less invasive, would be unethical and inappropriate. Male circumcision in cases where there is clear clinical need is not normally controversial. Nevertheless, normal anatomical and physiological characteristics of the infant foreskin have in the past been misinterpreted as being abnormal. The British Association of Paediatric Surgeons advises that there is rarely a clinical indication for circumcision. Doctors should be aware of this and reassure parents accordingly. Children who are able to express views about circumcision should be involved in the decision-making process. I shall come back to that more in a moment. There is a spectrum of views within the BMA's membership about whether non-therapeutic male circumcision is a beneficial, neutral or harmful procedure, or whether it is superfluous, and whether it should be done on a child who is not capable of deciding for himself. The medical harms or benefits have not been unequivocally proven, but there are clear risks of harm if the procedure is done inexpertly. Doctors must consider whether their decisions impact on a person's human rights, and if so, whether the interference can be justified. Rights that might be relevant to non-therapeutic circumcision include: no one shall be subjected to torture or to inhumane or degrading treatment or punishment. Everyone has the right to liberty and security of the person. Now, where have I heard that before? Oh, that's right. The World Health Organization on female genital mutilation. The BMA cannot envisage a situation in which it is ethically acceptable to circumcise a competent, informed young person who consistently refuses the procedure. So it's ethically acceptable to circumcise a child too young to even talk? What? When assessing competence to decide, doctors should be aware that parents can exert great influence on their child's view of treatment. But I need to ask you, what other body part can we remove for non-medical reasons under the authority of the parents? There is no other body part. The general perception has been that no significant harm was caused to the child, and therefore, with appropriate consent, it could be carried out. The medical benefits previously claimed, however, have not been convincingly proven, and it is now widely accepted, including by the BMA, that this surgical procedure has medical and psychological risks. Again, female circumcision has been outlawed for this very reason alone. If there is a risk that a child will be circumcised in unhygienic or otherwise unsafe conditions, doctors may consider it better that they carry out the procedure or refer to another practitioner, rather than allow the child to be put at risk. On the other hand, very similar arguments are also used to try and justify very harmful cultural procedures such as female genital mutilation or ritual scarification. Furthermore, the harm of denying a person the opportunity to choose not to be circumcised must also be taken into account, together with the damage that can be done to the individual's relationship with his parents and the medical profession if he feels harmed by the procedure. The BMA identifies the following as relevant to an assessment of best interest in relation to non-therapeutic circumcision: the patient's own ascertainable wishes, feelings and values, the patient's ability to understand what is proposed and weigh up the alternatives, the patient's potential to participate in the decision if provided with additional support or explanations, the patient's physical and emotional needs, the risk of harm or suffering for the patient. It is claimed in the media that thousands of girls in the UK are at risk from female genital mutilation. Does the NHS offer female infant circumcision to minimise harm? No. The courts have also identified some factors that are important in a decision about circumcision. Jay was a 5-year-old boy who lived with his mother, a non-practicing Christian. His father, a non-practicing Muslim, wanted him to be circumcised. Asked to decide whether Jay should be circumcised, the court considered all the factors relevant to Jay's upbringing and concluded that Jay should not be circumcised because of 3 key facts. He was not, and was not likely to be, brought up in a Muslim religion. He was not likely to have such a degree of involvement with Muslims as to justify circumcising him for social reasons, and as a result of these factors, the small but definite medical and psychological risks of circumcision outweighed the benefits of the procedure. So as you can see, religion alone is being used to justify male infant circumcision when this is not the case for females. There is significant disagreement about whether circumcision is overall a beneficial, neutral or harmful procedure. At present, the medical literature on the health, including sexual health, implications of circumcision is contradictory and often subject to claims of bias in research. Doctors performing circumcisions must ensure that those giving consent are aware of the issues, including the risks associated with any surgical procedure, pain, bleeding, surgical mishap and complications of anaesthesia. Doctors should ensure that any parents seeking circumcision for their son in the belief that it confers to health benefits are fully informed of the lack of consensus amongst the profession over such benefits, and how great any potential benefits and harms are. The BMA considers that the evidence concerning health benefit from non-therapeutic circumcision is insufficient for this alone to be a justification for doing it. Doctors must ensure that the premises in which they are carrying out circumcision are suitable for the purpose. In particular, if general anaesthesia is used, full resuscitation facilities must be available. Some doctors may refuse to perform non-therapeutic circumcisions for reasons of conscience. Doctors are under no obligation to comply with a request to circumcise a child. I feel the need to show you again the article from the World Health Organization. Female genital mutilation, otherwise known as female circumcision, is nearly always carried out on minors and is therefore a violation of the rights of the child. The practice also violates the rights to health, security and physical integrity of the person, the right to be free from torture and cruel, inhumane or degrading treatment, and the right to life when the procedure results in death. But look what we have at the top. Female genital mutilation has no known health benefits. Let me remind you of what is included as female genital mutilation. Type 1A, removal of the clitoral hood or prepuce only. Type 4, all other harmful procedures to the female genitalia for non-medical purposes, for example, pricking, piercing, incising, scraping and cauterization. My doctor told me that being circumcised as an infant was okay because it can be used to treat phimosis. But phimosis, it seems, and I'm pretty confident in saying this, is completely normal in newborn boys, and it's only over a several-year period that the foreskin becomes retractable. So really, phimosis is only an issue in much older children and adults. So it's claimed there are no health benefits to female circumcision. But I've discovered there is such a thing as clitoral phimosis. Look at this site by a group of gynecologists. When the clitoris is completely and tightly covered by the foreskin, it is a condition known as clitoral phimosis. This causes the sensitivity of the clitoris to be either greatly reduced or completely lacking in any feeling at all. But it's not just them that are saying this. Here is a website called sexualhealth.com, run by a group of doctors. One of the questions posted by a woman was, "From time to time, I get a sudden pain in my clitoris. I don't know what this is, but I'm not able to have pleasurable sex. Do you have any advice?" Later in the answer, it states, "It's also possible you have a genetic condition. Some women experience clitoral pain if the outside of the clitoris, the hood, or foreskin in men, is too tight. This is a condition called phimosis. There's more research on this condition in men, but a breakthrough in 2002 study in the Journal of Sex and Marital Therapy found that 22% of women suffering some kind of sexual health problem had clitoral phimosis." Patient.co.uk say, "Female phimosis is an uncommon and poorly recognised condition." I wonder why. A study from a sexual dysfunction clinic found that clitoral phimosis was present in 22%. This may have been contributing to dyspareunia, which is pain through sexual intercourse. And here is the actual study. Clitoral phimosis, a previously undiagnosed physical finding, was identified in 22% of the women. Other than its link to sexual pain, the clinical significance of this finding, in particular the relation to diminished sensitivity and impaired orgasmic capability, is unclear at this time. Here is a very recent article by secularism.org. Hospitals in Sheffield carry out about 200 non-medical male circumcisions a year, costing the health authority in the region of £170,000. Now, in an attempt to save money, the NHS Sheffield's Clinical Commissioning Group has proposed to make families who want their sons circumcised pay for the procedure. Each operation costs about £1,000. Now, I can't see many adult men wanting to be circumcised for no medical reason, so I assume all these circumcisions are being done to infants and children. If we are to assume that all counties in England are spending £170,000 on non-medical circumcisions, put that into the calculator and you have a figure of about 14 million being spent at the expense of the taxpayer on non-medical circumcisions, aka genital mutilation of boys. It's actually worth reading this full article because it's quite condemning of male circumcision, as is The Guardian, who have published several articles all condemning it very recently. We need to stop cutting bits off children's genitals when it's medically unnecessary. You cut the genitals of a girl, you go to prison. Do it to a boy, and you receive a paycheck. Our most pleasurable body part mutilated in the name of religion and myth, that is, Judaism and warped health advice. For the doctor, rabbi or moral that's cut 1,000 babies is not easily going to be labelled a serial child abuser. For that reason, intactivists have a long, hard fight, and what makes it even more challenging is we need to make changes without this turning into a witch hunt.